Hello, I am Antonio Claudio Nóbrega. It's a great pleasure for me to be here to moderate this panel. It's a great honor to participate on such an important event. I would like to thank my friend José Villar for his leadership with the FIS initiative in promoting such relevant debates for the country and for the world. It's a globalized world, and during the pandemic we need to have a global mindset. Today we have a theme on this panel that is very thought-provoking, so dialogues on health and especially the future of medicine. And about the future, we can say that the future is already here, it has arrived. If we are to recap the history of medicine, and as we said before, and Professor Margaret used to say, we cannot plan for the future without looking into the past. I would like to greet the fellow panelists, renowned people with a very fast observation and the very extensive CVs. Dr. Denise Garrett, she's an epidemiologist and vice president of the Sabin Vaccine Institute. Professor Duarte Nuno Vieira, president of Portugal's National Academy of Medicine, and Luiz Roberto Londres, founder of the director and founder of the Institute of Medicine and Citizenship, and Dr. Dalcolmo, pneumologist and a teacher at Fiocruz. So for everyone on this panel, I could highlight very important activities in medicine and health, and also in terms of leading the changes that are operated in our lives and in our professional practice. I, as a physician and currently as the dean of a major federal university, I feel it's a great honor to have their presence here today. So if we go back in a very simplistic way, maybe the history of medicine, going back to Hippocrates and going back to the Middle Ages, to the surgeon barbers, uh, and until Pasteur discovered the microorganisms, the development of antibiotics, until we get to the 20th century, when the evidence-based medicine gained more prominence and experimentation, gained strength that is a must in the practice of medicine. We got to the 21st century with the doors open to a pandemic, something that has caused and is still causing in all of us an analysis of the meaning of medicine and how we should practice medicine and the major challenges that, or more specifically, the big challenge, which is to articulate the tradition of consolidated medicine, the art of relating to people, the art of identifying problems that affect people and developing cure processes with the novelties and technological innovations. In the world of bytes and atoms, and therefore, this is a challenge which will certainly be the basis for our discussion. And we are going to work with a presentation, each about 10 minutes for each one of our panelists for this theme. And then we are going to have a conversation, answering questions. And I'm sure 1 hour and 10 will be a short time. But without further ado, I would like to thank you very much for your presence here today. And I would like to give the floor to Dr. Denise for her opening remarks. Thank you very much for the presentation. It's a great pleasure to be here with you in such renowned company on this panel. Thank you very much, José, for the invitation too. And the subject is, in fact, very thought-provoking, the future of medicine, because the pandemic has revolutionized medicine in many different ways. The medicine that was already going through a process And the pandemic was a catalyst of those changes. And now navigating in the healthcare system, they have gone drastic transformation almost overnight. And then they have come to stay. And they are not going to go away once the pandemic is past. And so we have telemedicine, and it has become an important way for people to communicate with doctors, 3D printers, virtual simulations, to improve the customization of medicine, quality. And we have personalized implants, customized treatment. We have new technologies such as nanotechnology. And then for the happiness of epidemiologists and public health care professionals like myself, the medicine is increasingly more preventive. The focus on prevention is increasingly larger. One interesting episode that many of you do not know, which is on last year's New Year's Eve, an artificial intelligence platform for outbreaks and pandemics called Blue Dot in Canada detected an anomaly. And that platform recorded a group of uncommon cases of pneumonia in Wuhan in China. So Blue Dot, as I said, is based in Toronto, Canada, and they use natural language processing and machine learning to trace and locate and report the dissemination of infectious diseases. So this platform on New Year's Eve, on that night, it sent warnings to many customers of the platform, including healthcare services, government companies, and other public health agencies. And what the platform had detected was what became known as COVID-19, and it did it 9 days before the WHO published the warning reporting the appearance of a new virus. And the role this platform had in the detection of COVID is just one of the first examples, and a big example, of the intervention of artificial intelligence in medicine. Not just in terms of detecting outbreaks, but artificial intelligence has been playing a very useful role in medicine. But until the pandemic hit, its role was kind of more fragmented, and in many ways fragmented because we were not aware as we are today of the importance of data for artificial intelligence and for it to provide solutions. And today we are flooded with data. And in the last year of pandemic, artificial intelligence took a great leap, and it's been used for prediction through screening, warnings, contact warning, faster diagnosis, automated deliveries, discovery of medications. We already have big opportunities of using models, artificial intelligence models, for the discovery of medications and genome sequencing, stem cells, CRISP, and much more. And in addition to that, people are already using biosensors and intelligent domestic sensors to keep safety and keep information. And as the quality of the data increases, the use of those wearables is going to be even higher. And what am I talking about? I'm talking about wearables like this one, this watch here that I am wearing on my wrist is the smartwatch. And this watch monitors my heart rate, monitors my sleep habits, monitors my saturation, physical activity, diet. and even mental health in terms of meditation and other things. So in addition to all of this watch can detect atrial fibrillation, uh, sleep dyspnea, and even diabetes. When I wake up and go cycling alone, it may detect if I fell or not, if I'm not moving. My watch will call emergency services automatically, a family or friend, and I'm going to end my time. And this is a very thought-provoking issue. And I'm going to close with a vision of the future. And this vision is not in the far future. Let's say in 15 years, I will wake up one morning, any morning, 15 years into the future, and I note that there's something bothering me in my throat.
I go to the loo, brush my teeth, and a sensor in the mirror in the bathroom will measure my temperature. A little after brushing my teeth, I get an alert from my medical assistant from AI that there are some measurements that are not normal in my saliva sample, that I have a temperature. And this AI will suggest that I take a test, a blood test with a needle pinch. And whilst I'm still having breakfast, my assistant has returned with an analysis that maybe I'm catching the flu, the kind of flu that I may be catching. It suggests to video call times with my doctor if I want to talk to her. And when I call the doctor, she will have on her system all the results of my tests, all the details of my symptoms. She will prescribe medication, paracetamol, or whatever it is, that will be delivered my place by a drone, the same day, same time. And I'm going to leave this suggestive image to provoke debate as to how I see medicine in the future. Thank you very much for your time. Thank you very much, Denise. Thank you very much. Actually, your final provocation is quite intriguing because some of these things already happened. You put them at a time when they will be consolidated and integrated. So that's quite intriguing because the Internet of Things, the so-called, the wearables, these monitors, they actually can automate many of our decisions. And I would like to hand over to Dr. Duarte Nuno Vieira and ask him to naturally make his presentation and bring this vision that Denise has brought us to the doctor, to the relationship doctor-patient. How these two realities can dialogue. Thank you very much, Professor. Apologies, I had no sound. Greetings to all of you here at this debate. It will be a friendly relation greeting from Portugal, from the University of Coimbra, my university, wishing all to be well, your families well. Special greetings to colleagues in this debate, panelists and organizers of FIS for the invitation they made to participate and the interest of the debate, that with accuracy of these facts, and say that it is a pleasure and honor to be here. I apologize, I speak with a Portuguese accent, which is a different type of accent. Sometimes leads us to use some words that in Brazilian Portuguese may have a meaning that is slightly different, but then I feel that the language evolves, improves. This is part of it. The future that I'm thinking about outlining not only the situation, the pandemic, what I envisage for the future of the medical activity exercise. The future is somehow present. So we certainly are repeating ourselves. We don't have so much imagination to view things. So certainly, there are several things that we envisage in similar ways. In fact, we lived in a time that was characterized by very fast changes, very dynamic changes, big changes in knowledge. And they also market and AI changes that involve our new procedures, new ways of interaction, and medical practice. We are going through a spectacular time of innovations at all levels, technology to augmented reality. So AI to cycles and technology, there are changes that no doubt will continue to come up at an absolutely fast space, more increasingly more significant, although we have to be aware that they will continue to depend, as always happens to changes, they will depend of political decisions, demographics, the climate, the conditions of the planet. All of this can perhaps change the way things evolve. The world changes, the world interacts, and every time the world interacts, it impacts us all, and the very evolution and the way the future will come up. Actually, one of the things that the future will certainly bring to us is an ecosystem that will be broader in terms of partnerships. In medicine, our partnerships were located within professionals, healthcare or fields close to health, pharmacy, biology, etc. Our interaction today is expanded. There are mathematicians, engineers, computer scientists, and of course the interactions to this ecosystem that is broader will certainly bring to algorithms that will necessarily lead to a new border in terms of activity of the medical activity. What can we prospect and expect for the future? What do I see the future of medicine will be? Denise has focused almost everything. Of course, artificial intelligence will be one of the main elements. It will continue to develop. And today, nobody has any doubt that it will provide machines ability to absorb and process medical information on a large scale, practically endless, all the medical structure, and maintain this permanently updated. But more, we know that machines will be able to develop themselves and develop in themselves resources to develop functions and procedures that today are not possible for machines, but probably will be able to be feasible in the future. We hope this does not lead to what happens in the Terminator, the situation which machines dominate the world. We'll have another type of change, fundamental changes in medicine. We're going to go from treating symptoms of diseases to treating the genetic roots of disease. Actually, it's not at all new. It's part of the genetic therapy has been developed for about 30 years. But actually, in the past 10 years, we've had advances that have been huge that lead to the development of new technologies and robust technologies to inject genes in human cells. And so things have become more accessible and they enable the possibility to check and find out about genetic causes of diseases. There are over 1,000 trials happening in terms of tests of new genetic therapies, and therefore there will be a field of intervention. This will develop and expand extraordinarily. In the next 20 years, we're going to have a single blood test that immediately will inform all the diseases we run risk of diabetes, and other things from a single genetic test. People will be informed of the risk they can have. As the vaccines today, they were part of the agenda with the pandemic. They will also expand greatly their expansion. We see, for example, 2 vaccines for the agents causing cervical cancer and several times, and there will be a multiplicity of new vaccines that will avoid many of the pathologies that are very severe in many places in the world, and there are of great concern. We have other things. Medical technologies in the future will enable not only repair disadvantages of physical limitations that a citizen has from birth, and then it will also allow the development of greater abilities. In the future, it will be possible to have a human being, to have vision of eagle, and hear like a bat, and everything. And so ethically, so we have to see what the boundaries will be and how far we can provide this or use this kind of technology to treat my clinical situation or my disability, and to what extent I can go beyond the limits of what nature had provided to me and built into this way. Note, for example, implants. So, brain surgery. So the laser surgery was some decades ago. It was so advanced at a great pace. We started having chip, and in the future they will provide perfect eyesight to see in the dark. We have cochlear implants that provide uh, perfect hearing. People can have memory chips that we can expand greatly our ability of memorizing to limits that may be unthought of, unheard of. So we're going to have in the future many possibilities. So we have cyborgs. So people that wear pacemakers, they are a cyborg in a way. But in the future, cyborgs will be developed. There will be procedures that will be much more complex. And I reinstate there will be people to request implants of certain devices without having medical problems, just to improve their performance. From the ethical standpoint, it will actually create new ethical problems. And so ethics has always followed the advances of science. So ethics is also dynamic. So it has to follow the scientific and technological advances. Denise has talked about 3G prints that are reality and enable in the future preparation of specific patient organ or prosthesis totally adapted to their religion, like nanotechnology totally being technology in the next 20 years will be great support for treatment of many pathologies, and stem cells we produce will enable the treatment of atherosclerosis, and certain medications can act in specific parts of the organism at the right times, at the right places, tapping into what the treatment can provide. All of that linked to the development of pharmacogenetics in the future. Medications will be individually prepared and then according to the genetic features of the person. So they will have the personalized or tailor-made medication. Medications are produced industrially equal to all. We know people that have certain types of reaction or do not respond to the medication as most citizens do to certain special features that lead to the response not to be the same. As I say, that with the development of technology, lots of other things will come up. Robotic surgery will be increasingly less invasive, increasingly more precise. Results will certainly provide faster recovery, less suffering to patients, and will enable distance intervention that will be great help for less developed countries, for example, that are more needy. So possibility of having healthcare access, um, and then we can develop several other things, many of which people talk very little. A company headquarters in Boston suppose that treated boys, they are directing, developing digital biomarkers for certain pathologies, especially in the psychiatric area, of other severe diseases by biomarkers that through the analysis of the voice allows you to see when the person has health issues and that have to be followed up and treated. I'm not going to talk about telemedicine. The pandemic has helped to consolidate it as a reality. I think we all realize the great importance that telemedicine has, obviously with certain limitation. And as all these devices enable at a distance to listen to the heartbeat and the heart rate and make a physical examination of a person, and these things develop telemedicine will have an application that will be increasingly better. And then all the other things coming up, wearables, the uses. So people will have, like Denise's watch. So they will actually monitor several parameters, real time and transfer that to a database, and then you get an alert, and then you have units of medical emergency that go into a situation in which they require support that should be sent. All of this to give you an answer to the request of the magnificent president. What we have to have in the future is to have this new potential that will enable us to give more years to life, but more life to years. If we're going to have all this potential, we must continue working towards ensuring global accessibility, that is, reducing huge inequalities that we have now, not allowing the technologies to further increase these inequalities, because obviously if we allow inequalities will be even greater between continents and even within the same continent between countries, because of their economic level. And we have these disparities, something from the ethical standpoint we have to try to avoid at all costs, and therefore we have to try to fight these inequalities and move towards equality and opportunities. So the goals proposed have to be not only of development, but once again, goals from the past as well. Inclusion, equity, and equity, equality of opportunities. All of those are important because otherwise nothing is worthwhile if we don't have dignity of human being, principles, solidarity, and it is also fundamental that these new technologies, all these devices, will not cause the relationship between medical or doctors and patients at risk. So as I tell the students at medical school, the first thing we have to do is to actually stand your hand or hold to your patient. This is the first therapeutic act that many times is the main gesture and fundamental therapy. I think I've gone beyond my 10 minutes. Thank you very much. And sorry for the Portuguese accent. Makes it more difficult to appreciate what I say.
So it's delightful to hear you speak. Your words. So after hearing Duarte, I'm sorry. So you all need to read Essa de Queiroz, Saramago, and all our wonderful authors. Sensational, really. The word ethics is cross-sectional and it's present in every human relationship and also in our relationship with technology. I'm sure our time is going to be short, and I'm going to give the floor immediately to Dr. Luiz Roberto Londres. Thank you very much, Luiz Roberto, for being here with us. Please. Please open your microphone, sir. Ready? So I would like to remind you that I had a master's degree in philosophy in a Catholic university in Rio de Janeiro. The first class I heard Heidegger, and he says everything goes back to what it was, but only differently. And then Nietzsche, who talked about the eternal return. So it's great to hear everything we heard and how this is going to enrich medicine, but it cannot impoverish medicine, because a book that I find fundamental, Danilo Peresteiro, and it's called The Medicine of the Person, not the patient, the person as a whole. And human beings are biopsychosocial. So in my experience of life, and before I stopped practicing medicine, I saw this happening. And one day I told my father, well, I'm kind of frustrated. I'm a good student. I study a lot, but half of the patients, they have no physical disease, only half. Um, and then my specialty was cardiology, and people were really afraid of heart diseases. And while talking to a person, we could get to points that might not be something physical, but something caused by their minds. So I remember back then, we had radiology and radioscopy, and some tests that back then we called complementary tests. and today, mistakenly, we call diagnostic medicine. And I'll say diagnostic medicine is here in clinical reasoning. And I even have some slides saying, and I don't know where I found it. So you put a patient on a piece of equipment. The piece of equipment doesn't have a brain. The brain is yours. And in talking to a person, you can get to the diagnosis. And I'm going to mention a book, an author rather, House Baron. He says something that is related very much to my experience. A good history, you have 90% likelihood of getting to the correct diagnostic hypothesis, because tests were done to confirm and quantify your first hypothesis. So your savings were brutal. And then, this thing you said was very important. To establish a good physician patient relationship is fundamental, because the person could open much more uh, rather than just reporting symptoms. So I think this is what will happen in the future. And with everything that you said, and I'm sure Margaret will add to, but this is the main theme, which is to establish a personal doctor-patient relationship and to have a full history. And undoubtedly, because what we are seeing here is that today there is a transparency. And if you saw the movie 1984, and everyone used to say everything to the big brother, this is somehow happening. But the psychological aspect, I'm going to mention two very brief facts. Patient came to my office with 4 symptoms, and I had a year and a half that I had graduated. And then he had 4 symptoms, which didn't make any sense together. And I had learned that you shouldn't go for the physical without any hypothesis. And I continued talking to him. And then all of a sudden, it came to me. It dawned on me. Doctor, I went to the World Cup in England, and 2 months later I had this. Uh, and then I was going to for Christmas in São Paulo, and then after I was in Petropolis and something else happened. I calculated. So World Cup July, 2 months later September, and then December, 3 months before September, and I left. And then I wanted to learn more about his personal life, talking to him, this and that. When did you get engaged? September. To me, the diagnosis was done. Started talking about his engagement. And then I said, is it affecting your engagement? And then he slapped his forehead and says, I think this is my engagement. The problem is that he loved his fiancée. They got on very well. He changed his job. She came from a very wealthy family. He got a new job and scheduled the wedding. So he had the scheduled wedding with the daughter of a millionaire. How do you get on with your future father-in-law? Talk to him, and then come back in 3 weeks. And then he came back cured from everything, very happy. The father-in-law welcomed him. I want you to marry my daughter. And this was just based on history. There's another case. Someone I know went to the hospital. And then you got my daughter's diagnosis right. My sister's, oh, I don't know your sister. She has phalangocytoma. And then I remembered that he had said, well, I'm going to explain to you how I got to the diagnosis, and I'll tell you something and tell me who the character is. So there's a little girl in a forest with a big bad wolf. Yes, the Red Riding Hood. So the history of phalangocytoma, once you study the natural history of the disease, from what you told me, that type of hypertensive crisis, number one, your urine test, and then you have the diagnosis, and not the 4 years. It took her dozens of tests, and only 4 years later, she could have a diagnosis. So going back to the idea that medicine is the meeting of people, And the meeting of people is the title of my master's thesis. So medicine is the meeting of people. So this is fundamental, full anamnesis and full history is essential. And undoubtedly, this is going to provide major advantages provided that is not destroyed. So what we see today, so I used to take out an hour and a half in the first appointment. And in the other appointments, at least half an hour, at least. And depending on the case, a little bit more or less. And today, how long do you have for an office visit? Quarter of an hour, and because the health plan helped, but well, it also worsens things. So there's health assurance, very good idea to share the cost. And it was a not-for-profit organization, the first health plan. But now every health plan is highly profitable, and what really matters is money. And the symbol of medicine, which is a snake, and now it's a snake with two rods, uh, which is the symbol for money. And so we need to think about that. We need to go back to personal relationship. So personal relationship, personal doctor-patient relationship, you need to see the biosocial and aspects. You need to order additional or complementary tests and then prescribe medication. Two things I see today. Non-allopathic therapies have been growing with very good results. One of them is physical therapy. My own experience with physical therapy, so high cholesterol on statin, and I went to a major orthopedist full of pains all over my body. And number one, are you on statin? And then I remembered a flight in a late Varig. And then once the flight attendant said, I was a cardiologist, said, I have high cholesterol. And every year before having his tests, he used to take aubergine uh, tea, and his cholesterol went back to normal. And then I got eggplant capsules, and my cholesterol is back to normal. This and other things too. So I say that the future of medicine is to taking care with medications, uh, take care with blood tests, take care with health plans, and remember that uh, the personal relationship and the history are the two cornerstones for the practice of medicine. This is the way I see things. I don't know if there's anything else I'm going to see. No, this is it. And also, another thing that is important to learn, everything that can be avoided, obviously, that is getting little by little, is that the idea of prevention is something very important. Now, let's hear Dr. Margaret. Well, certainly we are going to hear. I would just like to pinpoint a few of the things you said, Roberto, which goes back to my initial question. How are we going to make this dialogue between disruptive and transforming technologies with a medical practice, eye on eye, and a personal relationship? Dr. Margaret, you, in fact, during the pandemic, you have gained visibility, which was really soothing to us. Having someone capable of translating medical and scientific information in such a clear and grounded way. Thank you very much.
Thank you, professors. It's a pleasure to be here. And I need to repeat. Well, we have the great land overseas, Professor Duarte, great, very fond of our, even I, who have no Portuguese origin, I am totally Italian, as we call carcamano in Brazil. And I've even changed my approach now, Antonio, because the information have been quite dense and thorough, and I'm going to try to find a new path for my talk, because we think, and there's so much to be said in such a short time. Some of the concepts I'd like to bring up for our debate, it seems to be very important, looking prospectively what medicine would be from now on, at a time that nobody else in the world, 18 million inhabitants in the world, regardless of the access, considering that information reaches very fast, it disseminates as fast as a pandemic. Nobody can think that we're going to have new pandemics. So it's just a matter of time. It's not that we're going to have other pandemics. So we have to look from this angle. So I'd like to say is actually something that has been made clear more than ever. It is clear to us doctors that we taught and we watch that we have this ambiguous life, that the transdisciplinarity is the concept of the future.
But if we have the pretension of building a medical team based only on the centrality of the work of doctors, and this does not clashes with a doctor-patient relationship, because more and more, and I have just participated and made notes recently on a debate I participate about the hospital of the future, and I am going to comment a little bit. What will the hospital of the future be like? What is the hospital relationship or care relationship that we have? How are we going to address that from now on? And unlike what many think, the hospital of the future will no longer be these gigantic things with many stories. The hospital of the future will respond to the challenge of the need of the population to of a resource limitation that will be there, and social values.
So they will be like this. They will be smaller in size. They will be much more complex. Clinical outcomes will actually be the point, the criterion for payment of procedures. There will be highly specialized genomic vigilance and highly customized medicine, individualized, not only in the doctor-patient relationship and doctor relationship with the hospital structure will necessarily be different, customized care management of chronic patients. We recently go through this, so we need to create conditions to care for people that are aging. So the role of hospitals will be totally different, creating this that I would call so the biodiversity is not only doctor patient, but with a structure that supports them, cares for them, and using artificial intelligence, of which none of us can let go. Looking at the question, looking at the past, Antonio, I would say as to how we're going to make this not a distraction, but actually something practical. And then I bring up the task of us doctors. How are we going to train a new generation of doctors? What does the doctor of the future have to have, in addition to humanity, reminding the father of all Avicenna's, they would only let his records to be released after years of medical learning, after they had gone through the humanity test. So Avicenna's continues to be very present, not only my imaginary, but as it should be the imaginary of all of us. The doctor of the future should have huge technical skill, has to be able to be a leader. They should leave their own den. They have to know about public policy. They have to know how to communicate. Look at what the pandemic required for many of us, Dr. Duarte. We left our clinics. We went to the public. We exposed ourselves. We unbuilt complex information as we had to decode a molecule, a genome, and we transformed this language that Habermasian. Everything is language. It's true. The doctor of the future has to have a commitment with learning, as Dr. Habermas says. So currently in Brazil, we live a catastrophic epidemic of the number of medical schools that is totally intolerable, training doctors that have nothing of this that I'm saying. Most of them because they are not taught. The commitment to learning has to be highly qualified and inserted in the reality where they work. They have to know how to operate with emotional intelligence necessarily. There's no way a doctor dealing with technology without turning that into conflict. What technology is and doctor-patient relationship is diamond, this preciousness that will never be overcome by any technology or AI. So emotional intelligence necessarily has to be mastered. They should have management skills. When people talk to them, they are not enemies. It's not a boss. They must have learned that. They should be able to learn what they're doing. Otherwise, transdisciplinarity will again isolate doctors. They should know technology, information technology. So this is a vision that gives us a medicine that is not just a spectacular watch of Denise's. I was even looking at it. I don't even wear watches after mobile phones. We go into ICUs, etc. We cannot wear anything. So I felt like buy one of those watches. I'm going to ask Denise to bring me one when she comes to visit next. And actually, ultimately, what I wanted to say is that this detachment between what the new findings are, prospecting the healthcare structure, humanization of health, all of this is a holistic ensemble of things that necessarily, and I'm talking to the president or the dean of a great medical school that is a federal Fluminense University professor of the Coimbra University, great doctors and trainers. So this is what our students must have from now on. We can no longer have that student that in the third medical school year, be it good or bad, goes into intensive care unit, starts living with the drama. They don't even have maturity to live in between life and death. And lastly, I'd like to say, Antonio, new medicine must humanize death. We live very much or very long, and we necessarily need to care better. And for this, this care structure necessarily goes through revolution of size, format, and also training and human resources, not de-technologizing, if we can use this term, of humanizing death. Legal mechanisms, obeying, of complying with the wish of the patient and what we want to call the will. So that are used in the Scandinavian world, in a more developed world, necessarily respecting values, cultural values that have to be implemented along with the advanced directives, not only in the training of doctors and the relationship of us, doctors, and healthcare professionals and people we're going to care for, diagnosis, etc. So ultimately, these would be my comments, sort of provoking a discussion that no doubt I would have half a dozen questions to bring up to Professor Duarte, Denise, and Roberto, but I'm not going to monopolize the time. Thank you once again very much. It's even difficult to choose a direction because actually they have been topics that are so relevant, so brilliantly put forth by all of you. We have two questions that already are part of the debate. A question on multidisciplinarity, Margareth has brought it up, greater dialogue than parts of knowledge being different, but truly the intertwining of these disciplines is certainly fundamental. And I would like to draw the attention to two aspects. One is access. Professor Duarte put it quite well, and there is a concrete concern that the advance of technology may increase inequality. And access to these technologies may actually be turned into something that is actually stratified for the elite. So the access may be restricted, but as it gains scale, it may have more outreach in the use of those technologies. So I would like to focus and ask you to comment on regarding what we perhaps do not do very well in medical schools in Brazil in particular, which is learn how to learn. I still feel that we still live in Brazil, what Paulo Freire called banking, bank teaching, so transfer of contents to students as if they were empty of any analytical ability and would just needed contents. No doubt there's logic, simplicity left if it still exists. What we need is to learn and forever. And I'd like to ask for your comment, perhaps starting with Denise, of this vision and the development of vaccines. Doctors at all ages and all times, having been graduated, are learning about vaccines, vaccine platforms, the fact that they are not 100% effective. So I'd like you to address your view, Denise, and all. I'd like to ask all of you to comment on how to learn a bit from life as doctors. This is a movement that can sort of outline everything we're talking about, learn about the contents of technology, but being re-provoked, if this word does exist, on the relationship doctor-patient. How do you see continuous learning, Denise, please? Thank you for your question. Now, this is something that I have been actually during the whole pandemic reflecting upon. I am at the University of Minas Gerais, and there are excellent professors. At the time I attended many years ago, I attended it. It was an excellent course in Minas Gerais, a great deficiency or lack I see today. Of course, I follow the path of public health and epidemiology, but training in school on science, on how science is made, on scientific articles, papers, and this goes very much on this aspect you've mentioned, the lack of preparation and learning between my peers now in the medical school WhatsApp group amongst my classmates. I see there is no training as such, and classmates are considered as excellent professionals, but there isn't constant, continuous learning that you've mentioned. There isn't this scientific training, that knowing that science is dynamic, that it changes, of having this learning. And I think this is also a question that in school, well, a lot of what we've learned in school, and you know how to make a good clinical record, a physical examination. There isn't, at least I'm reporting my personal experience. We did not have this encouragement to actually have continuous learning. I don't have the answer to that. This pandemic has burst open a lack of learning in the medical world to understand how science works in terms of following science. And actually, I'm going to pass to other panelists to make their proposals, because I don't have an answer as to how to address this in an effective way, I would say. But Denise, nobody has an answer. If somebody has a complete answer to any drama we're going through, has not yet understood the question. This is the provocation. The provocation is that all of us have a lot to learn, right? So the more we learn, the more we know that the question increases. Lack of knowledge is much greater than we imagine. So we're getting various questions here. And I think there is a question that is extremely important here. being quite pragmatic in this sense. There is a concern, and actually, there are some people that have asked this question. Every time people talk about artificial intelligence, there is an immediate reaction that it would replace jobs. And perhaps this, to a certain extent, may be the resistance. Of course, a new area, knowledge, medicine, technology may cause some kind of uneasiness for people that are not close to it. But we have this total fear. What do you think about this? If you want to answer this, let's try to have a chat here. This is a question I would love to hear Professor Duarte on this. And we have this vision as so that we have this view as how an European sees that. And this question asked by Josier. And this is a concern that we should discuss at other times as well. Is this the reason why we perceive an unclear way, a certain reactive behavior, I would even say a reaction behavior regarding this technology? I think so, especially in the country with so much inequality like Brazil, where we have medicine that many times is dichotomic. And right, Professor Duarte, so we have public health system and private medicine. This many times can certainly create. Why? Because the training of these thousands and thousands of doctors that many times are in Brazil subject to the need to have various jobs to be able to make ends meet, let's say, in dignity to themselves and their family. This generates a lot of uncertainties. This may generate from the collective consciousness how people react or why people react to the use of artificial intelligence when we know that AI is something that absolutely does not dehumanize at all. As Luiz Roberto said quite wisely, and Denise too, we all have said that. Nothing replaces and will replace the personal approach between two people. One that is ill, that needs something, and the other one that is caring and assisting the other person. When I explain what perhaps is demanded, and that's what I said, the doctor will have to have technical skills, a leadership component, very well trained, which schools absolutely do not provide, most of them. So you have the youngsters that is massacred by that absolutely absurd teaching hours. They get a degree at 22, 23 years of age without having the maturity, having to face life and death. And they give their sort of death certificates. Just to give an example, was I failed a student at a residency test, Roberto, he said at an oral interview, and then the patient died. Well, first of all, this verb, well, he used a term that does not exist in Portuguese, deceased or something like that. And so said in this sort of this nonchalant way, it's totally unacceptable to me. And then people said, Margareth, oh, his test. Well, no way. He has to actually take in learning in a different way. This is it. Once again, I'm sort of provoking you so that we should reflect upon it.
And then as Professor Duarte, I would love to hear Professor Duarte. If you allow me, I need to apologize. I didn't hear everything Dr. Margareth said because my internet crashed. I'm sorry I didn't hear everything, but I would like to make 2 or 3 comments here. And so about that maybe artificial intelligence might take away jobs in the medical industry. But now we have learned in the past, and as recently our colleague was saying, we always need to look into the future, bearing the past in mind, and technology and new paradigms for intervention they reduce needs in terms of labor, but not in terms of human intervention. Certainly, there will be lower needs, but this may provide an advantage that will allow the redistribution of the clinical staff of physicians into other areas where they may work and where it is necessary. So I see progress as something that will help rather than destroy. Uh, And then, if this is going to destroy the need of some professions in some areas, I would say no. I think that all events in artificial intelligence and technology will really support the work of humans. I think in forensic medicine, so autopsies and everything due to religious, they cannot do it. For example, oftentimes I was involved with that situation. And then I had many problems because of that for autopsies that sometimes were on the hospital. And then it makes it possible for me to investigate it, and it will make it possible for me to understand better. And depending on the help that you need, work in many different areas, especially in forensic medicine, which was one of the questions here, whether this work will become obsolete. And something that machine will not replace is the doctor-patient relationship, reporting a test result, the relationship, making contact with the family, and machines will never do that better. And we need to learn how to read a person, a family member, and we can transmit. We need to think on how and where to say or to give bad news, and this is all important. And our activity, unfortunately, has not always been performed in the best way possible. And sometimes schools of medicine forget to provide human education. Um, other than just technical information, and that is definitely not enough to have a good doctor. Luis, Roberto would like to say something. Can I say something now? Yes, please. Well, first, three things. Number one, I learned one word, which is pedromorphosis, that things, mutations help during the larva or fetal phase. And Brazil is number one in the world with number of schools of medicine. Only India has more schools of medicine. If you add up the schools of medicine in US and China, the total is the number of schools we have in Brazil. It's impossible to understand it. When I graduated, the state of Rio used to have 4 schools of medicines, all of them public. And then in the best hospitals in the city of Rio were public or not for profit. They were models of hospitals. So this idea that medicine is something social and humanistic, this is very important. And this should come back both in the medical education and in hospitals. Another thing, so what did I used to do at Clínica São Vicente? I used to have monthly or quarterly questionnaires of how people were seeing the organization. Patients, accompanying persons, physicians, and employees. And this was really great because it was not just the objective aspect that interested me. Perception was fundamental. And what happened was that the percentage of approvals went up and up and up until it got to 97%. And that feeling, we felt almost like family.
Medicine has to be human.
Medicine needs to be human in itself. And another thing that I used to say when for other people, and I'm going to be very brief before I end, is those who only know medicine don't even know medicine. So Abel Cardoso, Yes. To be honest, that author is attributed to many authors. In Portugal, it's attributed to Salazar, and then to also in Spain to a Catalan doctor. And so if you just know medicine, you don't even know medicine. Now I am going to exercise my role of a moderator. I'm being told that we have 3 minutes. I know there wouldn't be, the time was not enough. So 1 minute each, please. I'm going to go through the same order for your closing remarks. Please, Denise, you can start. Yes, I can go first. It's less than 1 minute, but I would like to touch on this issue of the loss of medical jobs lost to technology. I think this is a fallacy, actually, because I share the same vision as Professor Duarte, and I think, in fact, it's going to increase efficiency of medicine, of doctors, and this is going to create the need of multidisciplinary teams working with other professions, engineers, administrators, nurses. And actually, I see that the sphere of loss of medical jobs is unfounded. So I think there's a lot to say, and it's impossible to address everything. I really loved being here with you on this panel and just hear your vision. And once again, thank you very much for an invitation. And we are all going to work for a better future in medicine and a more equal and fairer future for everyone. Thank you very much. Thank you, Denise. Professor Duarte, please. Thank you. Just in conclusion, I would like to thank you once again for the invitation. It's an honor to take part. It's an honor to share this panel for the first time with my colleagues, and what I really hope for the future of medicine, as I was saying shortly ago, is that it will not just add more years to life, but a better life to the years that we have. Thank you all very much. Thank you. Thank you very much, Luiz Roberto. Well, it's been great. And I have a message to Josier. Now you have the responsibility to do many things to improve medicine. And I am absolutely sure that medicine is going to go back to its principle, humanistic and social. I have absolute faith in that, and I am going to fight for that. And whatever he can do, he will do that. So, Ricardo Cruz, he used to have those events at Samaritano, remember? So things like that are to develop thinking in people and trying to disseminate how we can help disseminate this idea on the basis of medicine. Great, Margareth. In addition to thanking you very much to have the honor of having the dean moderating us, I think that we cannot be too abstract. What I hope is that the new medicine may bring a level of requirement and that the new doctor, just talking about doctors without forgetting transdisciplinarity. No one is an island. No one does anything alone. The modern world has proven that. The pandemic has proven once again that none of us did anything alone. We have lived an experience that has marked our lives. And in talking about universe, we doctors cannot give up that we can artificial intelligence, emotional intelligence, doctor-patient relationship, and to understand once and for all that there is no dichotomy here, Dean Antonio. This is all the same thing. So when I talk about humanizing death, I'm talking about improving the quality of life of those that we provide care to. And Professor, we don't need more years. We need more quality in the years that we have, and each one of us can do our share without giving up. Just in conclusion, Antonio, Life in year 1000 was very bad. All the plagues in the Middle Ages were very bad. The epidemic would not be controlled. They were controlled because they ended by themselves. Today we can predict, and as Denise said, using high technology to predict even the next epidemic and prepare ourselves technologically in making good use of technology uh, and be prepared for it. Thank you very much. Wonderful. Great. So if you allow me, I would like to complete with something is Isaac Newton used to say, and it was an adaptation from the Greek mythology. It says, if I could so further, it's because I was standing on the shoulders of giants. So on the shoulders of the tradition of good medicine, we will see a better future. And I'm sure we're going to work for that. Once again, I would like to thank each and every one of you. It's a great honor. So I'm going to write this moderation on my resume, having such renowned colleagues. I would like to thank the FIS initiative, and we are waiting for the next one. Thank you all very much. Have a good afternoon. Goodbye.